100 questions and answers for medical competency exam. Topic: Medical emergencies 1. What is the first step in managing an unconscious patient? Answer: ensuring an open airway. 2. What does the acronym ABCDE stand for in emergency assessment? Answer: airway, breathing, circulation, disability, exposure. 3. What is the primary step to control massive bleeding in trauma? Answer: direct pressure on the wound. 4. What is the recommended chest compression rate during CPR in adults? Answer: 100 to 120 compressions per minute. 5. What is the first drug administered in cardiac arrest due to asystole? Answer: adrenaline, epinephrine. 6. What is the main action for managing airway obstruction? Answer: Heimlich maneuver. 7. What is the initial step in trauma patients suspected of spinal injury? Answer: spinal immobilization. 8. What criteria is used to assess a patient's level of consciousness? Answer: GCS, Glasgow Coma Scale. 9. What is triage? Answer: a system to prioritize patient treatment based on severity. 10. What triage color indicates a critically ill patient who can still be saved? Answer: red. 11. What is tension pneumothorax? Answer: a condition where air is trapped in the pleural cavity, causing pressure on mediastinal structures. 12. What is the emergency management of tension pneumothorax? Answer: needle decompression in the second intercostal space at the midclavicular line. 13. What is the primary goal of administering crystalloid fluids in hypovolemic shock? Answer: restoring intravascular volume. 14. What is the main sign of septic shock? Answer: hypotension refractory to fluid administration. 15. What is the dose of adrenaline for anaphylaxis? Answer: 0.3 to 0.5 milligrams intramuscularly. 16. What are the classic clinical signs of massive pulmonary embolism? Answer: sudden dyspnea, pleuritic chest pain, and tachycardia. 17. What is the first step in managing a patient with extensive burns? Answer: stop the source of heat and begin fluid resuscitation. 18. What is the Parkland formula for calculating fluid requirements in burns? Answer: 4 milliliters times body weight, kilogram, times percent total burn surface area. 19. What is the initial action for a patient electrocuted by high voltage? Answer: ensure the power source is turned off before touching the patient. 20. What is the first step in managing a poisoning patient? Answer: identify the toxin and call for medical assistance. 21. What device is used to assess a patient's oxygenation in the field? Answer: pulse oximeter. 22. What is the main cause of cardiac arrest in trauma patients? Answer: hypovolemia due to bleeding. 23. What is the hallmark ECG finding in cardiac tamponade? Answer: electrical alternans. 24. What are Beck's triad clinical signs of cardiac tamponade? Answer: hypotension, jugular vein distension, and muffled heart sounds. 25. What is the main intervention for cardiac arrest caused by ventricular fibrillation? Answer: immediate defibrillation. 26. What is the characteristic chest pain of acute myocardial infarction? Answer: substernal chest pain radiating to the left arm or jaw, lasting more than 20 minutes. 27. What is the hallmark ECG finding in ST elevation myocardial infarction, STEMI? Answer: ST segment elevation in 2 contiguous leads. 28. What is the initial treatment for STEMI? Answer: MONA, morphine, oxygen, nitroglycerin, aspirin. 29. What is the first step in managing ventricular fibrillation? Answer: immediate defibrillation. 30. What are the key clinical signs of acute heart failure? Answer: sudden shortness of breath, pulmonary edema, and orthopnea. 31. What is the first-line drug for acute heart failure with pulmonary edema? Answer: furosemide. 32. What is the mechanism of action of nitroglycerin in angina pectoris? Answer: coronary vasodilation and reduction of preload. 33. What are the characteristic symptoms of pulmonary embolism? Answer: sudden dyspnea, pleuritic chest pain, and hypoxia. 34. What is the primary diagnostic tool for pulmonary embolism? Answer: pulmonary CT angiography. 35. What is the first step in managing severe asthma unresponsive to bronchodilators? Answer: intravenous corticosteroids. 36. What are the diagnostic criteria for status asthmaticus? Answer: severe asthma attack unresponsive to standard bronchodilator therapy. 37. What is the first-line drug for acute asthma attacks? Answer: salbutamol, beta-2 agonist. 38. What is the characteristic ECG finding in acute pericarditis? Answer: diffuse street segment elevation and PR depression. 39. What is the main emergency treatment for severe hyperkalemia with ECG changes? Answer: intravenous calcium gluconate. 40. What is the hallmark of a hypertensive emergency? Answer: blood pressure greater than 180/120ths of a millimeter of mercury with acute target organ damage. 41. What is the first-line treatment for hypertensive emergencies? Answer: intravenous nitroprusside or labetalol. 42. What is the initial step in managing a large spontaneous pneumothorax? Answer: chest tube placement, Thoracostomy. 43. What is the primary cause of cardiac arrest in acute coronary syndrome? Answer: ventricular fibrillation. 44. What is the indication for thrombolysis in STEMI patients? Answer: chest pain less than 12 hours with ST elevation on ECG. 45. What causes hypoxia in patients with acute pulmonary edema? Answer: fluid accumulation in the alveoli impairing gas exchange. 46. What is the main treatment for pulmonary edema due to heart failure? Answer: furosemide, nitroglycerin, and oxygen. 47. What are the main clinical signs of acute exacerbation of COPD? Answer: increased dyspnea, purulent sputum, and cough. 48. What is the first-line treatment for acute exacerbation of COPD? Answer: bronchodilators, salbutamol, ipratropium, corticosteroids, and antibiotics if infection is present. 49. What are the criteria for diagnosing ARDS, acute respiratory distress syndrome? Answer: refractory hypoxemia, bilateral infiltrates on chest X-ray, and absence of heart failure as the primary cause. 50. What is the primary management for ARDS? Answer: mechanical ventilation with low tidal volume and PEEP settings. 51. What is the initial step in managing a head trauma patient who is unconscious? Answer: ensure airway patency and stabilize cervical spine. 52. What are the classic signs of uncal brain herniation? Answer: unilateral pupil dilation, contralateral hemiparesis, and decreased consciousness. 53. What is Bottle's sign? Answer: bruising behind the ear indicative of a basal skull fracture. 54. What is the maximum score on the Glasgow Coma Scale, GCS? Answer: 15. 55. What is the hallmark of acute ischemic stroke? Answer: sudden onset of focal neurological deficit. 56. What is the first-line drug for acute ischemic stroke meeting the time criteria? Answer: alteplase, thrombolytic. 57. What is an absolute contraindication for thrombolysis in stroke? Answer: intracranial hemorrhage seen on CT scan. 58. What is the classic feature of an epidural hematoma? Answer: lucid interval followed by rapid decline in consciousness. 59. What is the key difference between subdural and epidural hematomas on CT scan? Answer: subdural hematoma is crescent-shaped, while epidural hematoma is biconvex. 60. What is the primary treatment for status epilepticus? Answer: benzodiazepines, such as diazepam or lorazepam. 61. What is the primary cause of febrile seizures in children? Answer: fever due to viral or bacterial infection. 62. What are the diagnostic criteria for bacterial meningitis in cerebrospinal fluid, CSF, analysis? Answer: elevated white blood cell count, high protein, and low glucose levels. 63. What is the first-line antibiotic for bacterial meningitis? Answer: ceftriaxone or cefotaxime. 64. What is the initial management for generalized tetanus? Answer: administration of tetanus immunoglobulin and antibiotics, such as metronidazole. 65. What are the hallmark signs of a basal skull fracture? Answer: hematympanum, cerebrospinal fluid rhinorrhea, or raccoon eyes, periorbital ecchymosis. 66. What is the first step in managing a trauma patient with massive bleeding? Answer: control bleeding and initiate fluid resuscitation. 67. What are the clinical signs of fat embolism syndrome after a long bone fracture? Answer: dyspnea, petechial rash, and altered mental status. 68. What is the fast, focused assessment with sonography for trauma examination used for? Answer: evaluation of free fluid in the peritoneal, pericardial, or pleural cavities. 69. What is the initial step in managing a joint dislocation? Answer: immobilize and perform reduction after radiological evaluation. 70. What are the clinical signs of neurogenic shock? Answer: hypotension, bradycardia, and warm, dry skin. 71. What is the main management for a complete cervical spinal cord injury? Answer: spinal stabilization and respiratory support. 72. What is compartment syndrome? Answer: high pressure within a muscle compartment causing tissue ischemia. 73. What is the definitive treatment for compartment syndrome? Answer: emergency fasciotomy. 74. What is the first step in managing a patient with a penetrating abdominal wound? Answer: stabilize the patient, prevent fluid loss, and prepare for surgical exploration. 75. What is the hallmark of cardiac tamponade in trauma? Answer: hypotension, jugular vein distension, and muffled heart sounds, Beck's triad. 76. What is the most common cause of apnea in neonates? Answer: perinatal asphyxia. 77. What is the first step in resuscitating a neonate who is not breathing spontaneously? Answer: clear the airway and provide positive pressure ventilation. 78. What is the recommended chest compression rate for neonatal resuscitation? Answer: 90 compressions per minute with a 3:1 compression to ventilation ratio. 79. What is the indication for epinephrine administration during neonatal resuscitation? Answer: heart rate remains below 60 bpm despite positive pressure ventilation and chest compressions. 80. What are the clinical signs of severe dehydration in a child with acute diarrhea? Answer: sunken eyes, poor skin turgor, and absence of tears. 81. What fluid is used for oral rehydration in a child with moderate dehydration? Answer: oral rehydration solution, ORS. 82. What is the initial management for a febrile seizure in an infant? Answer: control seizures with diazepam or lorazepam and reduce fever. 83. What are the first-line antibiotics for neonatal sepsis? Answer: ampicillin and gentamicin. 84. What are the clinical signs of hypoglycemia in a newborn? Answer: weakness, seizures, and hypothermia. 85. What is the initial treatment for hypoglycemia in a newborn? Answer: intravenous glucose 10%. 86. What are the clinical signs of respiratory distress in a neonate? Answer: chest retractions, tachypnea, and cyanosis. 87. What is the primary cause of septic shock in children? Answer: severe bacterial infections, such as meningitis or pneumonia. 88. What are the clinical signs of dengue shock syndrome in children? Answer: hypotension, bleeding, and hepatomegaly. 89. What is the main treatment for dengue shock syndrome? Answer: fluid resuscitation with crystalloids or colloids. 90. What are the hallmark signs of eclampsia? Answer: seizures in a pregnant woman with preeclampsia. 91. What is the main management for eclampsia? Answer: administer magnesium sulfate and stabilize blood pressure. 92. What is the first-line antihypertensive for severe preeclampsia? Answer: labetalol or hydralazine. 93. What are the clinical signs of placental abruption? Answer: abdominal pain, vaginal bleeding, and a firm uterus. 94. What is the main treatment for severe placental abruption? Answer: immediate delivery, usually via cesarean section. 95. What is the most common cause of postpartum hemorrhage? Answer: uterine. 96. What is the first-line treatment for postpartum hemorrhage due to uterine? Answer: intravenous oxytocin. 97. What is the initial step in managing a prolapsed umbilical cord? Answer: elevate the presenting fetal part and prepare for emergency delivery. 98. What are the clinical signs of uterine rupture? Answer: sudden abdominal pain, loss of uterine contractions, and massive vaginal bleeding. 99. What is the first step in managing a pregnant woman in hypovolemic shock due to bleeding? Answer: immediate fluid resuscitation and hemodynamic stabilization. 100. What are the clinical signs of puerperal sepsis? Answer: fever, abdominal pain, and foul-smelling lochia.